ladies and gentlemen. Thanks for watching us today on KTV2. I'm Dr. ANOUD JUWAIHEL, a family physician. I will be glad today to carry on the show with you. And today it's going to be a very, very interesting show. And it's going to be about dermatology with dermatological consultants. And it's all going to be about the different injection types and the fillers. And I think it will be very interesting types of show. So if you have any queries or any questions with regard to our shows, you always can contact us through our information provided on the screen right now. Welcome back, dear viewers. Before I go to my guest, I would like to announce that the Asthma and Diabetes Institute would like to announce a new openings of sleep disorder clinic, which is held actually by Dr. Abdul Mohsen Turki. And the opening and the ceremony of the opening will be on the 4th of September at 10 a.m. And all of you will be actually invited to see that. And then we're going to have our interview today with our special guest. She is a consultant in dermatology, Dr. Noora Al-Slaili. Hi, Dr. Noora.
Hi, how are you?
Thanks for accepting our invitation, Dr. Noor.
This is a pleasure for me. I'm really happy to be here today and for your invitation. I really appreciate it. Thanks.
Thanks a lot. Dr. Noora, we would like to start with you about the different fillers and the botox. But before we go into that, we would like to ask you, can you define for us what is exactly the beauty? The word beauty, what does it mean nowadays? Has the word beauty, the definition of it has been changed during, lately these years?
Well, we always say that beauty, there's limitation, there's range of beauty. You can't say there's specific beauty. Because blonde, when you see a blonde lady, you would say she's really beautiful.
Yes.
When you see black lady, you say also she's beautiful.
Yes.
So there's not specific range of beauty, but you always, when you see something which is matching each other, like if you see, I would say the face. If you see the face, the eyes, the nose, and the lips, and the whole face as a whole is really a nice, she has a nice feature, you would say this is really, she's beautiful. Yeah. The other thing is that the beauty, you always say it's beautiful, but also you always think about healthy. So like if you see people who are slim, you always say they are really beautiful. So being healthy and having a healthy skin, healthy body and healthy mind, healthy hair, you always relate it to beauty.
And not necessary to forget about the whole characteristic and the moralities of the person that could represent the
we always say the eyes. The first thing which attracts a person is the way you look. Before even you speak, before even you, they know exactly who you are.
Exactly.
So they always take you from the way you look, not necessarily the way you, in your personality.
So with regard to your work, do you see a lot of people asking for certain measurements, specific length of the eyebrow or specific raise of the cheek? Or
definitely, always we see this in daily pace. If you work in a cosmetic clinic, they always, I would say 90% of the people, they know what they are coming for. But there is also misunderstanding of what they need. Because most of them, they always say, my face is dull.
Yeah.
I feel that I'm getting old. They never relate it to aging.
Yeah.
They never related to fat atrophy. They never related to the skin laxity.
Yeah.
They never related to the muscle relaxation of the muscle. In real life, when you exceed 25 years of age, you are getting older.
Wow.
25, yes, wow. 25. You never think that my face and my body is working for 25 years.
Yeah.
Okay, in near life, if you are real life, you'll be retired. So this is true.
Yeah.
After the age 25, all of us, we feel that our skin is dry.
Yes.
The forehead is lax. Our eyes is little bit lax. My eyes is not healthy like before.
Yeah.
Even if I put the shadow, it's not like before. Even if I put the eyeliner, it's not like before. If I put my foundation, it's not like before. And my skin is not healthy like before.
Yeah.
Even with moisturizers. So this is the truth. There is an aging process happening after the age of 25.
Yes.
You see the muscles are lax. There's fat atrophy in the forehead, in the cheeks, around the nose, which we call it nasolabial line,
Yeah.
and the merit line around the mouth. The mouth also becomes dull and not healthy. There's no volume in the mouth. So this is all related to one specific description of the patient. My face is dull.
All right. Do you think there is something could speed up the aging process or speed up the wrinkle process?
Definitely. The way you deal with your face.
With the age.
Yes, many people, they think it's only creams. How I put creams. No. They always think also the way I sleep. Yes, definitely. Sleeping is important. You put creams and healthy skin. You don't sleep with your makeup. You put extra moisturizers. Yes, very important. But related to many studies, number one is the main reason of aging is the sun.
The sun exposure.
The sun is, yes. That's why if you see your face and you see your hands, the quality of the skin and the look of the skin itself completely different than other places of your body.
Exactly.
Okay, the areas which is exposed, you always see the skin is dull.
Yeah.
There is a range of colors, like you'd say the colors is yellowish, brownish, grayish. The elasticity of the skin is different.
Exactly.
Like if you pull the skin, it doesn't return as normal. The quality of the fat is less. So sun is number one. Number two, the way you deal with your face in a way of expressions. Like as much as you smile, you will have nasolabial. You'll have wrinkles around the eyes. If you are frowning too much, you will have wrinkles around the eyebrows.
Yeah.
The way you deal with your face also does play a very important role.
So facial expression.
Of course, you're using your face. That's why.
Okay.
Even the hands. If you shake a person with, he never worked. You'll see his hand is smooth.
Smoother, yeah.
It's healthy, nice looking, full. If you deal with people who are walking, you'll see their hands is really rough.
Yeah.
There's too much wrinkles because they're using their hands too much.
Yeah. What about healthy diet? Does it really affect the skin textures?
Healthy diet, yes, it's good. But also don't forget, if you lose too much weight, also does affect the fat content of your skin. We see a lot with this, with all bariatric operations, like we see a lot of bariatric operations these days, sleeve and bypass, all this. If you take care of a good health, yes, don't lose too much weight. Like I would always tell my patients, if they lose 3 to 5 kilos, it will affect their face.
Okay.
So either to keep your diet, you keep your weight, or if you lose, you have to think that I need more work on my face.
What is your advice for people who's going on sleeve? Definitely they're going to lose more than 10,
Definitely
15 kilos.
they will. I always tell them, don't rush to do bariatric operations. If you have fat in a wrong place, take it and put it in the right place.
Okay.
Sometimes it's much better than losing this fat.
Okay.
Because the woman, she needs fat in many places as a woman.
Yes, exactly.
So if she loses this fat, we can put artificial, which is the fillers, but it will cost her a lot. So before she loses this fat, which is healthy, she can do it as redistribution for the fats.
Okay. If we go, Dr. Noora, now to the different injections that we see nowadays, can we just talk first of all about the Botox injection?
Definitely.
What is Botox exactly?
Yes, we always say Botox is like a vaccine. I always tell them, if in the future they find something for vaccination for the kids, you'll see creams or oral therapy instead of botics, because botics actually it's an origin botulinum toxin, which is a toxin from bacteria, and usually it's by accidental finding. They did it for to correct the deviation of the eyes. So they found that when you inject botics around in the eye, it removed the wrinkles. So they used it for the wrinkle, and then they found that it removed the migraine, so they used it for migraine, and then they found it removed the sweating, so it's used for high doses for the armpit, for the hands. So the indication of botics, it's like a toxin which makes paralysis. In this way, with the paralysis, we see the overlying skin is smooth.
Okay.
So what you see is that it's used for wrinkles, hyperhidrosis, which is excessive sweating, and the other thing is for migraine. But there's many indications now for botics. We're using it. They're using it for the hemorrhoids. They're using it for the fissures. Hallux valgus, there's study for hallux valgus. They're using for osteoporosis. There's many studies according to the botics. Botics is advised to use it every 4 to 6 months. If you inject it within 4 to 1 week, you'll see the result. All the wrinkles on your face disappear completely, and it will last. We usually tell them with the first 1 month, the result will be very obvious, very prominent. After 1 month, it becomes very smooth. And it will last 4 to 6 months. But we have to understand something. But many people, they think when we say it lasts 4 to 6 months, it will disappear and my face will come back again.
To normal.
No, definitely not.
Okay.
I always tell them, see the people who inject botics, you'll see their face is getting much, much nicer and younger than before.
Okay.
Yes, so you have to understand that as much as you do it, even after you stop, after 10 years, you save your face for 20 years.
Okay, so there is a lot of advantage, and there is long-term changes with the botics injections.
Definitely. And they found also the quality of the skin, not only the wrinkles. The quality of the skin is more healthier, more shiny. So it doesn't remove the wrinkles also. It improves the quality of the skin, healthier skin, shiny skin.
Okay, that's very nice.
Yes.
Is there any side effect of botox injections? A lot of people are afraid of the side effects. So.
Usually, if first day, maybe second day, you have a mild headache. If you are really unlucky, which is, we don't see it a lot these days, if the botox is a little bit near one of the nerves, you can see the side effect. We see a lot at the beginning. If you start using botox at the beginning, you see few patients with ptosis. Ptosis is like you see there's a lag of the eyelid.
All right.
Yeah, the eyelid become a little bit closed. This takes 2 weeks to 1 month, and then disappear completely.
It will be gone. So
yes,
there is no.
But usually botox is really safe, but you have to watch the quality of the botox. Okay, so the botox which is approved by the FDA is only Allergan and Dysport. Yeah. These are the 2 botox which is approved from the FDA.
So it can be used not only for the face, can be used for the hands and the neck?
The botox, it's only for wrinkles. So what's used for the hands are the fillers. So if you think about the fat, from the name fillers, which is filling, it's used for the areas which is there's fat. So botox, you use it for the muscles.
Okay.
Yes,
so
for the eyes, the forehead, and between the eyelids and the
eyebrows.
The brows, yeah.
So how popular is the botox nowadays? Is it
very popular?
Used a lot?
Very popular. Most of the patients, they have it as a schedule. Like, I would say most of the patients now, they come do it routinely.
Okay.
Yes, routinely. Like I would say every twice a year, I do it for all my patients. And if she's really interested to have more result, I would do it every 4 months. But routinely done.
That's very nice.
Yes, when we come, the patient come, she already booked for botox, we do botox for her.
Okay, what about the fillers? You mentioned the words fillers. How different is it from the botox?
Yes, the fillers is, from the name, it's filling. So it fill up the areas which there is laxity of it. So usually before, they used to have fats.
Yes.
If you don't have fat, you have to have substitute. So your skin is building, making 2 materials, collagen and hyaluronic acid. The collagen, they tried to do it. They found it only stays 2 to 3 months only.
Okay.
And if it disappears, that's it. It doesn't give you any any long-term results. The hyaluronic acid, it lasts 1 year, and when it finishes, it leaves half of it stays and half of it will go.
Okay.
So if you put hyaluronic acid, it's much, much better than any other qualities. Hyaluronic acid also, there's 2 types, which is approved by the FDA.
Yes.
There's trade name, which is Restylane, Restylane Perlane, and there's Juvidem
Okay.
as a hyaluronic acid. But there's other types also approved by the FDA, like Radius, which is calcium hydroxyapatite, and Sculptra.
Is it the same material that can be used inside the creams synthesis for wrinkles removal?
Yes, definitely. All the fillers, you always think about the fillers. Many people, they think the fillers only filling. Like, I want cheeks, I want lips. No, no, definitely. In our area, they always say filling. But in real life, fillers are rejuvenation only.
Okay.
Rejuvenation. The only thing which keep your face young, you never age, is the fillers.
Okay.
So always think that my hand is getting old, I have too much wrinkles, think about fillers. My face is dull, I have too much wrinkles, not smooth, think about fillers, because it covers for the absence of your natural product. Like, your skin is not making any more healthy hyaluronic acid, so you give it the substitutes.
Okay. And is there any specific age, like you can give the fillers?
There's no specific age. You can't say there's, like lasers, like they always say laser, which specific age, like vascular laser, we do it for even one week. You understand? It's indication, but the problem is that, like, if we have laser or if we have fillers, does the patient will be cooperative? Is he eligible to control the pain? Because this is very important. Cooperation of the patient is very important.
Okay.
So I wouldn't do it for less than 16.
Okay.
Above 16, yes, it's acceptable. And the patient, they come, they understand what they're doing, because less than 16, they don't know.
Yeah.
Yeah.
And it will be the same injection or the distribution of the injection as the Botox? Or?
No, the Botox in the muscles above face. The fillers, usually, we inject it around the nose, which is, we call it nasolabial, for the cheeks, for the lips, and now we use it for the nose even. We use it for the acne scars, we use it for the scars in general. We do it for rejuvenation of the face. If you have any depression in the face, you do fillers.
And how safe is the fillers?
The fillers, if you use the safe ones, which is approved by the FDA, you'll not have any problems whatsoever. It can be controllable because there is, like hyaluronic acid, there is hyaluronidase, which is enzyme, can dissolve hyaluronic acid. So if there is any side effect from the hyaluronic acid, you can dissolve it easily. The same time you can do it. Like, I did it for you, you don't like it, that's it. I give you injection, which is enzyme, dissolve it completely.
It will never leave any scarring or
nothing.
any permanent things?
Nothing whatsoever.
Okay.
Yes.
So that's really kind
Yes,
of
this is
reassuring
it.
for the patients.
Very comfy, yes.
Yeah.
This is the truth.
And do you do any precaution things before you give the injections?
Usually we always advise stop all the multivitamins to avoid bruises. If you have herpes, you have to be careful. If you have any infection at the site, just avoid it. If you have abscess, also very important to keep in mind if they have also permanent fillers, because many people here in Kuwait, they use permanent fillers like Aqualift, silicone. This is not approved by the FDA. It's not approved whatsoever in the whole world. They have to understand, people, they have to understand there is fillers, there are many fillers. They are synthetic. It's like synthetic materials. It's not compatible with the skin. So if you inject it, it will not dissolve in your skin. Like when you say, this is recycled, this is not recycled. The same issue. If you put anything not recycled in your face, you carry this responsibility, because it will not be recycled to stay forever in your skin.
All right.
So this is the problem. If you see many people with abnormal features, they have side effect from the fillers, always think about the permanent fillers, not the normal, regular, safe fillers.
All right.
Yes.
And Dr. Noura, what is the rate of success, of the fillers, or the rate of satisfaction, as you can see in your own
Mostly,
clinic?
I would say 100%, or to be honest, 99.9, because many people, the time they do it, the second day, like if I do under the eye, it's swollen, bruises. So maybe after 1 year, they come back to you saying, yeah, I like it. The first 1 month, 2 months, maybe they didn't like it. But after 1 year, you understand, sometimes I don't tell the patient I have the enzyme. Because if I tell her, she will come the second day and say, oh, no, 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 I don't want to do it.
Yeah.
I want to remove it. But this is not good, because any injection you do, it takes, sometimes it's swelling, sometimes it's bruises. It takes time to relax. This is what I say, it takes time to relax. So sometimes it takes 1 month to relax, but in real fillers, it will take 3 months to become really nice. But I would say under the eye, I always tell them 1 year, but always stays for 2 years and never come back like before.
Wow, that's very nice.
Yes,
Yeah.
and the nose even. I always tell them fillers in the nose stays for 2 years.
Yeah, because I've got actually questions from the audience here. They say that she has a non-surgical treatment with the fillers for her nose, and she was saying, how frequent shall I repeat it?
As needed. If she see, okay, the fillers.
So how would you notice the changes?
In the nose, yes. In the nose, you always think about 3 things. You have to be, in Kuwait, I always say people, they have money, but they don't have, what they call it, education, good education or good knowledge. So if you do jobs for the nose, you have to understand what did you do exactly, because in the nose we use 3 stuff. Yeah. We use the fillers to build up the nose itself, to raise the nose, to remove all the depression. We use Botox to close all the muscles, like when I smile, my nose is relaxed. Yeah. When I talk, my nostrils opens. So when you do the Botox, which makes the muscle relax, you'll close the nostrils a little bit. And the other thing, which always they say, I need, what they call it, fat destruction injection. No, it doesn't relate to fat. This is only cortisone injection. We use cortisone injection for the nose. Cortisone, they discover it causes skin atrophy and cartilage atrophy. So many people, they say, no, no, I don't want to use stuff which can cause cartilage atrophy. In real life, if you do operation, this cartilage will be removed.
Yes.
People, they have to understand the injection is not like the operation. The injection, anything you do, there is a step back. You can't go back a step, or you can return to normal. But in the operation, no, you can't do it. So the cortisone, use it for the cartilage, yes. You do atrophy, yes, you do atrophy. And it was used after operation, like all these injections for the nose was done after operation actually. It was done long time. Okay. I would say 15 years. After any patient, after doing operation rhinoplasty, they used to do fillers, Botox, and Kinocort injection for the nose. Okay. To correct any minor abnormalities which was not done well with the operation.
By the
yes,
surgery
with the surgery.
itself. Okay.
Now, the only thing we do it before the operation.
Okay.
This is the only story, okay? So it makes it easy for everybody to do it.
Yeah, and what if they didn't like the changes?
They can they can dissolve it.
They can dissolve it.
They can dissolve it
okay, so it's like a makeup then.
Yes, that's it.
Okay.
This is the truth. This is real life.
Okay, that's very nice. They were asking that why some people have higher rate of success with getting the injections, and why there's some people are really unlucky.
Like if you have a short nose, if you have a short nose, if they give you only cortisone, which makes your skin, makes your nose thin, they didn't give you fillers to make your nose a little bit taller, you'll not have any change. Okay. If they give you filler and your nose is big, but they didn't give you cortisone to make your nose is smaller, not have any benefits. Okay. So you have to be smart, and the doctor has to be smart also.
Yeah, they should be going to very trusted doctors rather than...
Yes, this is it. And you have to understand that knowledge is not always enough. Always you have to have experience also.
Okay, that's very nice. I got a question from the audience. She was asking about the silicone. Has it been injected or just only for implantations?
It's not approved, it's not legal to inject silicone. This has to be very well known. Okay. Silicone is not allowed to inject on the skin. Okay. Whatsoever. It has, anybody, I'm telling you, it's not recycled. If you say it as a mild, simple terms for the people, it's not recycled in your face. So if you inject something as if you're taking this cup and put it in your face. Oh, it will not be recycled. Okay. It will stay there. If you have an infection, it will be a source of infection. It will be a dysmorphic feature on your face. If it does have any side effect, it will stay forever. And it's a material that you injected in the tissue, which it should be in an implant.
Okay.
It should be in a cover, not to inject in the tissue. So what happens if you inject it? Your skin will form fibrosis on top of it.
Oh,
So
that's
if
a
it has
huge damage.
fibrosis, you'll see, oh, my face is swollen, I have these lumps. This is because you inject illegal materials. We have to be careful because you always pay for the things you do it.
Yeah.
Yes, you do. You pay for the doctor, but you are paying for the things you do it.
Exactly.
Like I buy iPhone. I'm paying for the iPhone. You understand? But if you go and pay money for silicone, you're paying all the money for the doctor. You're not paying anything for the material.
Yeah.
Because the material is nothing.
Okay, so totally silicone
It's
is a
not allowed.
big no,
That's
no,
it.
it's not,
Yes.
not allowed.
It's illegal to use it.
And
Very
there is
illegal.
a lot of replacement that you mentioned about
Definitely.
the fillers and the botox,
Definitely.
which is really highly successful.
Definitely. If you go to cultures which is really educated, they always ask for the names. This is the problem in our culture. The issue that they always know about the type of the phone. They always ask for the type of the laptop. They always ask for the name of the bag, the dress, but they never ask for the even the makeup.
Yeah.
They never memorize the type of the fillers. What's the reason? They have to ask themselves. Even the laser. I always tell them the easy way to know if you are on the right track. Just check. Just put in the internet cosmetic clinic and check what other clinic all over the world. All over the world. I'm saying even in Eskimo.
Yeah.
What type of laser they're using, what type of fillers they're using, what type of botox they're using. And be in the safe side. You will see all of them, even if they're not doing it. They show that they are doing the best. And this is what you should ask for, the best.
I think this is a really important issue because nowadays there is a lot of unethical places or illegal places where they give injections, especially like in beauty salons, and there is a lot of side effects people can experience from them.
Definitely.
So what do you say about that? I mean,
it's illegal. This is it.
illegal.
It's illegal. You always say, if you do an illegal action, you carry the responsibility, you know, the salon and the person.
Yeah.
They never, you can't sue anybody which after you do illegal response.
they will always be attracted by the lower prices they offer, but on
Not
the other
definitely,
hand,
not definitely.
it
No,
is really.
it will be, yes, definitely. I saw places they do laser, illegal, higher price than clinic.
All right.
I saw people doing illegal procedures, more expensive than, or they can do it the other way. They will ask you, okay, I will do mesoface 10 KD, but I'll do it every other day.
Okay.
You
Okay.
understand? Either they do more sessions or fillers or botox. They do for you botox quarter of the price, but they will ask you to come and do it every 2 weeks.
Okay.
The same story.
Yeah. So now I think we have to go into a break, and our advice is to all our viewers is that they have to go to a trusted place where they can get the injection, especially dermatologists or specialists with this injection. So we'll go on a short break, and we'll come back to you soon.
Nisa. I'm a registered dietitian from Desman Diabetes Institute, and today I'm going to be talking about healthy eating at restaurants. So eating out at restaurants with family and friends is an enjoyable social activity, which most people in Kuwait do once a week to more, and most people do it actually more than once a week. Now, eating out at restaurants is something enjoyable. We get to go out, try different foods. But it may not be so pleasant when we consider its effects on our waistlines and the numbers that appear on scales, especially after a long weekend. However, the good news is eating out doesn't always have to be an unhealthy activity. We can actually work around it and try to make it healthy. So one thing that people can do is that when you go to restaurants, consider looking at the salad menu. A lot of people just ignore that because they're going out. They think, why eat salads? I can eat salads at home. Why not try all these different foods that are just decadent and tend to come with a lot of calories? So when you want to look at the salad menu, which also has a lot of choices, most restaurants now offer like an abundant number of salads, and they have different dressings. They have just different ingredients that make a salad actually pretty tasty. One thing you want to look at when looking at salads is a salad that's not made with creamy dressings like Caesar or Thousand Island, because they also come with a lot of calories and saturated fats, which increase your cholesterol and also just may contribute to weight gain. The salads that you should be eating are ones that have vinegars and healthy oils like olive oil, balsamic vinaigrettes. They have different fruit-flavored vinegars like raspberry vinaigrettes. A lot of them have lemon to add flavor. So you want to look at these salads. If you don't want to eat a salad and you'd rather eat something else, like let's say a burger or maybe a steak, you can try to make it a bit healthier by not ordering fries, but choosing to have a salad on the side or steamed vegetables, or even just boiled potatoes or just oven roasted potatoes. So then you can eat your steak, but add just a bit of healthy ingredients on the side. Another thing that you can do, which most people don't think adds like a large amount of benefit, but it does, is just not drinking soda or juices and actually drinking water. Or even if you want something like a bit, just fancier than water, you can drink like sparkling water or Pellegrino or Perrier. So you have all of these. If you want to add a bit of flavor to your water, you can add lemon. So these are just some ideas that you can do. And what happens is that when you take out the soda, then you're cutting your calories by, let's say, 100 to 200 calories, depending on the side of the soda. So it's a lot of calories. Another thing that you can do is, let's see, if you want to eat desserts, what you can do is, for example, order a light entree like grilled chicken or grilled fish, and then you can have desserts. What you can also do is order one dessert for the table and share it with your friends, so that you're just cutting your calories. Some restaurants now offer half portions, so you can order half portion of pasta or half portion of, let's say, sometimes they have half portion of, you can eat half portion of like a lasagna or a steak or something like that, and so you're also cutting your calories in half. So all of these things can make eating out healthier and more nutritious if you, let's say, you add a salad or something else like that. Something else that you can do is, for example, eat a fruit salad for dessert as opposed to cake or pudding or something else like that. So I wish you a happy and healthy life, and make sure you eat your fruits and vegetables and exercise often. Thank you.
Sebaceous unit, or PSU, of the skin consists of the sebaceous gland and the hair follicle. The sebaceous gland secretes an oily substance called sebum, which protects the hair and skin. Overproduction of sebum is related to the disease called acne, or commonly pimples. Sebum may collect excessively as a result of poor hygiene, genetic predisposition, or accelerated glandular activity, especially during adolescence. During an acne breakout, the pore of the hair follicle is plugged by a mixture of sebum and cells that line the hair follicle. The trapped sebum allows bacteria to grow in the plugged follicles. This forms the primary acne lesion called a comedo. There are two types of komedo, whiteheads and blackhead. When the sebum and bacteria stay below the skin surface, a whitehead is formed. A blackhead occurs when the trapped sebum and bacteria partially open to the surface and turn black due to melanin, the skin's pigment. Commonly involved areas are the face, neck, chest, shoulders, and upper back. Treatment includes keratolytics, retinoids, antibiotics, hormone therapy, spironolactone for women, isoretinoin in severe cases.
Welcome back, dear viewers. Now we're going to move to the most interesting part of the show. Dr. Noora, she will participate in giving an injection or the fillers to one of our lovely lady here. So, Dr. Noora, can you tell us what you are going to do?
Yes, definitely. So she came with the same complaint. My face is dull. I see that I'm getting older. So what you see is that, can you throw? Just, yeah. If you see this, we don't mean the fur. This means we assess how much skin excess in her forehead, you know.
Yeah.
So if you have this excessive skin, this means the fat, you have fat atrophy, that as much as you have the skin, this means that you lost too much fat in your forehead. Can you raise your eyebrow? This also, when you see this, you see there's too much lax of skin. So if you continue Botox, you'll not see this. You'll see your skin is tight. You'll never have a problem of aging in the future.
Okay.
So when you do Botox earlier, after the age 25, 30 maximum, you'll not see your skin is lax, you'll not see your eyebrow is low like your mom. Her eyelids is very lax, tracted down. No, you'll save your face the issue of operations. So before, between the age of 25 and 50, they didn't have anything for them. They always say, I feel I'm getting older, but they always put creams.
Yeah.
But they didn't have anything. Until the age of 40, they start doing operations for them.
Okay.
But now, after the fillers and the injections, they save the woman of getting the operation till the age of 70.
Okay.
And maybe she doesn't need it.
So the sooner the better then.
Of course.
Okay.
So what we put some numbing cream for her.
Okay.
So to remove all these wrinkles in the
forehead,
glabella and the forehead, and also, can you smile? Smile. Yes. All these wrinkles. So if you put the Botox within 1 week, I call it magic. Okay, we are really gifted in this age and this century that we have something that give you magic. Within 1 week is your face. That's it.
Okay, so
within
would
1
we
week.
see the results as soon as possible or just only after
1 week?
Okay.
Yes, you have the injection in the muscles. I'll show you where the injection is given. And then within 1 week, you see
the differences.
the difference within 1 week. After, of course, we say second day, third day, you see some changes, maybe some headaches. But after 1 week, you'll see your skin is
become more tighter,
nicer, and healthier.
That's very nice.
So this is the Botox. If you really follow the instruction, you'll do it every 6 months. I tell them, even you, it's better to do it every 4 months. And if you're really, really obsessed about getting really good result, even every 3 months you can do it.
Okay.
Yeah, but it's really give you a very good results. The other thing is that if you see under the eye, you would say there's atrophy of the skin.
Yes.
If you build the eye like this, see how change?
Exactly.
Yes, you see that if we put some fat, before they used to put some fat, so they do liposuction and they put the fat under the eye. So they improve the quality of the skin under the eye.
The crease.
Now, we don't need fat. There's a substitute for the fat, which is the injections.
Yes.
So we can put some hyaluronic acid here. Here in this area, we can put, can you smile? See, this is the quality of the, if you see this wrinkle, there's atrophy.
Yes.
So if you put here, her skin become tight like this. And if you put under the eye, it will be like this.
So in different areas,
Different
you
areas.
use the
So
same
if you do it,
materials.
we clean there. Okay. So if we do it for her, okay, of course, very important. Most of the fillers, legal fillers, FDA approved, is in injection in a box, closed. If you open it, this is one of the types of FDA approved, which is Restylane. There's one with the analgesic, one without analgesic. So if you open it, you see it comes with a filler.
So it should be very sterile, like as
Very
you can see,
sterile,
yeah.
very, yeah. And there's also expiry date for it.
Okay,
So you know exactly, and there's a number also. Even the company, they have a serial number for it.
that's very important.
Yes, and we always stick the sticker and put it in the patient file.
Okay.
In case if we have any problems,
Yeah.
we would inform the company and tell them, okay, this filler with the serial number, we have this problem with it.
And where you import these fillers from? Which countries?
This is from Swedish. This is Swedish. But if you go to the state, this is #1 is used.
Okay.
And there's the American one, which is Juvederm.
Okay.
But they always follow the FDA approval.
Okay.
It doesn't relate it to the origin of the products.
That's very nice.
Yeah.
So you gave her anesthetic cream before the
local
injections.
anesthetics, yes, definitely.
And then?
Okay, so if you see this, like under the eye, let's start under the eye. Can you see it? Yes. Just look up. Here. She will not feel anything. You already would give her.
So how many cc's you inject in me?
As needed. I usually put for them half cc. But some people I do more.
All right. So you feel the fullness, or you look at the fullness?
Yes, definitely.
Are you okay?
Yes, she doesn't have.
She doesn't feel any
no,
pain.
she doesn't
Okay,
feel.
that's very
It's
nice.
a very small needle. And we do massage for it. See?
So you
Did you see the
distribute-
difference? See the difference between this side and this side?
There is some differences. I can notice
Yes,
that.
because, yes, if you see, I would tell you, you'll see the difference if I pluck one. Okay? See the difference.
Yes.
Okay? See this eye. Now see the other one.
There is obvious wrinkles on the
Did you see
eyesides.
it?
Yes.
There's atrophy. That's why they always think fillers is filling.
Yeah.
But it's not. It's rejuvenation more.
Yeah.
Okay, so can you smile? So if we do it, do this area.
So that's in the nasolabial place,
Yes.
is it? Yeah. Okay. So it is very superficial when you're
Very
going. You
superficial,
don't go that
very.
deep, right?
You never go deep. You never.
And the botox definitely have to go to the muscles, right?
Yes, definitely, yeah. But the botox is safe. You never, if you have a problem from the fillers, because if you inject to a vein, we always inject, and then we draw. We check that you are not in a vessel, and then we inject.
And can this process used for people who are suffering from facial palsies? You know.
Yes, definitely. We can correct any facial palsy. The only one who cannot use the botox is the myasthenia gravis. That's it.
All right.
But otherwise, any people, they can use. See, I'll show you something here. Okay. Smile.
Okay. So you go to the place where there's a lot of wrinkles.
There's
there,
wrinkles, yeah, definitely.
Okay.
Okay, so here, we finish this side. Okay, here. I will show you something. Okay. So if you see this side of the skin, this side, of course, I should do for her also the right line there.
Yeah.
So we have to continue putting until we see, but if you see, just if you focus, okay, see this side.
Yes. Oh, there's
Okay.
changes. Yeah. It's very
Okay, did you
obvious.
see the difference?
Yes, it is.
It only gives you rejuvenation. Nobody will know that you did it. Nobody. So that's why I always tell my patient, don't tell anybody.
Yeah.
Nobody will know.
So would the result be more obvious after 1 week?
The
Or
fillers,
what
yes,
is
yes, the fillers, but the botox usually after 1 week.
Oh,
It doesn't
okay.
show at the beginning.
Okay.
Okay, for the nose, if you see on the side, he nose little bit low, so if you make it high a little bit, it will be nice. I'll show you. Don't worry.
So this procedure is to raise a little bit the nose up,
Yes.
and you are going from the mid of the nose.
Yes.
Okay. Okay.
Here.
And she's obviously not feeling anything.
She's feeling, but not that much pain.
Yeah.
And then, if you want to give her little, yes, right here, French nose, tip, French tip.
Okay, so you raise the tip. Okay.
That's it. That's
Okay.
it. Yeah.
Okay, this
Okay,
is a little
I
bit
would-
painful
yes,
for the
yes,
patient.
Not that much.
Yeah.
It's only the tip usually.
Yeah.
Okay.
Okay.
Okay. I'm sorry. Okay. So
Okay. I can
see
see
the
drastic
nose?
change now.
Yes.
Yeah.
you see.
Yeah. Okay.
Did you see the difference?
Yeah, there is
After, yes. Did you see how the nose become up? Okay. Also, I see there's pain, but I could inject here and here for these depressions. Little bit, huh? Little bit, only little. Don't worry.
Okay.
Don't worry.
Okay.
It's not painful.
Okay.
Little bit here, and here a little bit.
So it's safer from the surgery.
Definitely, yes.
Yeah.
So you see, all the depression. That's it.
It's gone. Yes.
Gone.
Yes. So I can see the slightly painful for the
Yeah,
nose.
slightly painful. That's
Yeah.
it. But did you see? You did a full surface for the face.
Yes.
Not that much. Also, don't forget, I didn't give her because we could give also local analgesics injection.
yeah.
But sometimes it doesn't need it.
Okay.
The Botox injection, we usually. I wouldn't do it now because the Botox need to be in the fridge.
Okay.
So we didn't bring it, but usually we do injection for the glabella and then the forehead and around the eye. Within 1 week, she will see the results.
Okay. So I think you've done a very good job now here. Maybe you're going to continue that.
Yes. So that's it.
Okay.
I mean, we could
Later.
also, for her, if you ask me, we could also do some lip.
Yes.
Yes, some lips.
Yeah.
We could do some cheeks also. If you see the cheek, in this area, we could do some cheeks. I can do the cheeks a little bit. 1 second.
And the patient may need that. You need that.
Yes, we
But
could.
honestly, I can see a lot of changes on the nose.
Yes, definitely,
Yeah.
yes,
Yeah. I
definitely.
didn't believe that when I saw.
Yeah, definitely. You can see it
Yeah.
easily. And the result is really nice. I'll show
It
you the
is.
difference between this side and this side.
Okay.
One injection.
Okay. So you're completing now the fillers for
Definitely,
Yeah.
I'm only
on
doing some.
one side.
Yes.
Yeah. It's very good. And you know, some people they have kind of retracted ears, or what do we call it, the outward looking
Yeah, this
ears.
is operation.
So there's no way that you can solve it
yeah,
with the
this is
injections,
operation, but it's local operation. It's very mild.
Okay.
Nothing serious.
Okay.
Yeah. With local anesthetics, and that's it.
Do you give any creams afterward after these injections?
No, definitely, we don't put anything. So if you compare this side of the face,
As you can see, yes.
yes, if you see, compare the side of the face with the other side, you see a big difference.
Yes, exactly.
The age, there's aging face. If you see, this face looks younger, less than 30,
Yeah.
and
you
this
can see.
face looks older.
So
Did you?
yeah,
It's very
It
easy, yeah.
seems like she's
younger,
Yeah,
that's it,
yeah,
she's younger.
Yeah. She's
Yeah.
yeah.
But we didn't touch major issues. We only touched the areas which she has a defect in. Like she has mild depression of the cheeks, we did it. She had some wrinkles in the glabella, forehead, and the eyes, we did it. We did only the nasolabial. Not necessarily you inject the whole face, not necessarily inject the cheeks.
So some areas
Definitely.
with atrophies
You'll
that you inject.
you look younger, you look only healthier. That's it. I wouldn't say even younger, healthier. You look healthy.
That's very nice,
Yes,
actually.
definitely.
Thanks for your participations, and we are probably going to give you some rest
Thank
right
you very
now,
much.
and then we're going to complete the other half, hopefully, before we leave.
Yes, yes.
Okay.
Wait for me.
Thanks
Yeah.
a lot. We're going to have for a small break, and then we come back.
Yes, definitely. Yes.
Welcome back, dear viewers. As you can see, we have a lovely demonstrations on the injections of the fillers on the face, and we also saw some injections on the nose and some corrections that has been made, and we saw the results instantly.
Definitely, yeah.
That's very nice. Actually, now if you want to talk a little bit more about what you are offering inside your clinic, there is a lot of talk about the plasma therapies. What is that exactly?
The plasma is it's a technique which is almost 20 years now. It's not a new technique. But now most of the people, they don't want something artificial. They're asking for things which is, there's no synthetic materials in it. Plasma is one, mesotherapy is second, laser is third. So you have options instead of fillers and botox, which help you rejuvenate the skin. But I wouldn't say it will substitute the botox and fillers. Definitely, there's a big gap between them. If people are paying for these stuff, which rejuvenate, help to rejuvenate, not instant rejuvenation, because you always think fillers and botox give you an instant rejuvenation. The other stuff it helps in rejuvenation. So if you do plasma, is we take from your blood, we centrifuge it, we take the plasma and the platelet-rich plasma, and we inject it for your skin. So you assume that you're having healthier skin, you induce collagen, you'll have, the texture will be better, the color of the skin will be better, the pores will be better. Also the mesotherapy, which is also vitamins instead of putting creams. You can have these creams in an injection form, and you can have it on your skin. Also give you the same result as plasma. And also the other technique is laser, because all kind of lasers also considered as rejuvenation. Like you have fractional laser with all type of lasers. It also give you very good rejuvenation for the skin.
Okay, we've heard about the word mesotherapy nowadays a lot, and every time we open the newspaper, there's a lot of mesotherapy. So, what is the true indication of mesotherapy?
Yes, mesotherapy is a Latin word. It means that you give the medication in the skin by the injection.
Okay.
This is the term of mesotherapy. So you can give for the fat, if you want to lose weight and destruct the fat, do destruction with the fat. You can give mesotherapy for the fat, for losing weight. And also there's mesotherapy for the hair, to induce and give the hair the substitute and the material that induce growth of the hair. And the other thing is mesotherapy for the face, to improve the quality of the face, to give you a rejuvenation for the face. So it's the basic thing is that instead of, to make it easy for you, instead of putting ampules of my hair, I do injection. Instead of putting creams on your face, you do mesotherapy injection. So it doesn't count on you. We always say that I'm not compliant. I don't take the tablets of antibiotics. I want injection for antibiotics. It's the same.
Okay, so and with regard to the safety margin of it,
there's there's also always you think about side effect as allergies. Maybe some people are allergic to some of the materials. Always you have to think about this. The other things that people with heart diseases, people with diabetes, you always avoid people with the risks, because this is it's not done for the people for risk. Why? Because it has vitamins, like people with cancer, people with autoimmune diseases, like if people also G6PD, you don't give them the BBC, which is the main constituents of the meso fats.
Yeah.
So always be in the caution for these people only.
Okay, so it's very important to take the past history of the patient in order to protect them from the side effects.
Definitely.
There is one question from the viewers. They were asking that a lot of people nowadays are doing the tanning for their skin.
Definitely, yes.
They were saying, is there any side effect of the tanning, especially for people who are having received the filling or the injections?
Okay, there's no relation with the filling injection with the tanning. This is number one. Number two, you should talk about types of tanning. Types of tanning, the safest way of tanning is the foundation, like makeup. This is the safest way. There's tan for the makeup, for the body, spray, brush, all these kinds. Even the face, there's foundation, there's blusher, there's many kinds of makeup, foundation, which is more safe. The only side effect you can see only with the pimples or the side effect of foundations. The other thing is that self-tanning. Self-tanning that you put, you don't need sun. So you only spray it or you put a cream and then within 20 minutes you have self-tanning. And this you have to apply it, it will last 1 week, almost 1 week. And if you do it, as much as you wash, it will go with the time. It doesn't have any side effect.
Okay.
The only side effect, okay, this area is tan, this area not tan, this is the only thing you say it. The third type is the sun assisted, like many spray of the tan, you put it, like you see there's carotene or many kind of tanning. You put the cream and then you have to sit in the sun. And then with the sun, it will pigment.
It will
Yes.
make a change, yes.
Okay, so the side effect, is it from the creams or from the sun? Definitely from the sun.
Okay.
So if you do tanning, always think you don't need to burn to have tanning. Okay, we always say avoid the sun from the 11 o'clock till worldwide is 3, but here in Kuwait I would say 5. 5:30 you should avoid the sun because you can easily have burning. The other kind is solarium. Many people, they like solarium. Solarium is there's a cabinet where they use UVA because the sun has UVA and UVB. UVB is the burning sun, and this is the reason which has aging. UVA is the tanning division of the sun. So as much as you do solarium, you'll have more aging.
Okay. Dr. Noora, we really enjoyed talking to you, and it was very nice to have you here. And we would like actually to have you maybe another show talking about the laser therapy, but because of the shortness of times we couldn't do that. Do you have any advices, final advices that you have to give to the patients?
Definitely. If we talk about the beauty, I always recommend go to a specialist, a board certificate, not anybody. Don't go to a new clinic with less price. You're looking for the price because it's not an issue price. Maybe you'll pay more than the money you paid at the beginning.
Yeah, as a correction.
As a correction. Okay, so you have to think twice.
This is actually a very nice talk with our Dr. Noora Al-Slaili. As you can see, she have a very good talk about the different type of fillers, and we have a nice talk about the Botox, as we saw also demonstrations on that. And then she insists and she advised a lot of our viewers and our patients, if you want to do that, anything of the fillers or the injection, you have to go to a legal place or specialist place where you can have the injection, and you will be far away from the side effects and the complication that you could be exposed to. Thanks again, Dr. Noora Al-Slaili, and we are very thankful for you to have you here. And thanks again, dear viewers. We have to probably see you next week. Thanks again, and bye.